Hi, my name is Dr. Nefertiti Noel, and I'm a clinical therapist. I run a private practice called NOWELL and Associates Counseling Firm, and I've been getting a lot of questions that people want me to answer about therapy itself, especially people who've never thought that they would need therapy or never thought about seeking out therapy. So I wanted to answer some of those questions for you guys today, so that if you decided to do therapy, or if you're in therapy and you want to seek another therapist, that you would not feel like, I'm afraid or I don't want to do it, because I feel like so many people don't know what to expect in the therapy room, that it keeps them away from getting therapy. And I want folks to be able to go from good to great. And if you're not doing so good, I want to increase your quality of life. And I really feel like therapy can help people do that. So the first question is, Dr. Noel, what happens in the therapy room? What happens when I come in and I tell somebody all of my business, right? What's going to happen with that information? So let me start at the beginning. The first thing you do is, for most people, you're going to do an intake where they ask you a string of questions about who you are, what things are important for you, what's going on for you, and how you're being affected by whatever reason you decided to come in, okay? So you come in, you meet the therapist, and hopefully you've done a little bit of background work on what type of therapy you want, what type of therapist you want. In other words, do you want a male therapist? Do you want a female therapist? Do you want a Christian therapist? Do you not? Do you want someone that practices a certain type of therapy? Those things are important. And you can get yourself educated on some things so that when you go into the therapy room, you can say, hey, I've looked at these things, I've heard of these things, how do you think they'll work for me? Okay, so you do the intake. Here we ask you a string of questions and we start talking to you about what your hopes are, what your goals are. So a couple of things. We will diagnose you, but you're never going to be diagnosed with something called crazy. People always ask me this. At the end of an intake session, they say, Dr. Noel, so am I crazy? And so let me tell you the answer to that before anybody says yes. The answer is no, because we don't have a diagnosis of crazy. Our whole purpose of asking people to come in or inviting people into therapy or being therapists is to help you go from where you are to where you want to be and give you the quality of life that you want to have. And the purpose of therapy is to help improve the quality of life and give you a safe space to talk about issues that may be affecting you from the past, that may be affecting you currently, some things that may be happening at work, or maybe when you were a child you had trauma and all of those things still affect you. And we want to help you process through those things, push away what you can push away, and gain some tools to get better with your life so that you don't end up being unhappy or feeling like you're not having the quality of life that you want. So basically the first session is a bunch of questions that we're using to determine who you are, what's happening for you, and how we can be helpful for you, okay? So that's a really good thing to know about therapy, that when you first come in, no one's out to get you, we're not trying to hurt you, and we're not going to use your information anywhere else. So that leads me to confidentiality. What you say in the therapy room will stay in the therapy room. Therapists are legally bound to protect your health information. We're healthcare providers, so we're legally bound to hear what you have to say, document what you have to say, but not leave and say anything about what you said to us when you're gone from the room. So we're not gonna go have dinner with a bunch of friends and a client come out and be the topic, right? Because that would be a breach of your confidentiality. So we're going to keep those things in confidence so that no one else hears them. In addition to that, one of the reasons that people really enjoy therapy is because you really don't have to see a therapist again. So you see us once a week for whatever span of time that your clinician thinks is important for you or that you feel that is needed for you. And then we don't do dinners together. We're not going to bump into you somewhere, and we're not going to take the information and use it against you in some way. What you say to us, we use to help you as a teammate in your recovery from whether it be depression or whatever issues that you're having, okay? Another myth that I have people come and they say, hey, Dr. Noel, I'm OCD, or they diagnose themselves and they say I'm OCD, or I have depression, or I have this, or I have that. And so one of the purposes of a therapist is so you don't diagnose yourself, right? Because there's a body of education standing behind your therapist. So most licensed clinicians either have a master's degree or they have a PhD or a PsyD, which is something that helps with either research or giving us more focus in our clinical studies, right? And so the data that we use from what we learned combined with what you tell us about yourself in therapy helps us get you to a space, or to teach you tools, or to give you the information that you need, right? And so that's the first time that you sit down in the therapy room. Dr. Noel, can I be a believer in God and also have therapy? Is there something wrong with me if I believe in God, but I'm still having depression or still having other features of a mental health issue? And the answer is yes. You can love God completely and still need assistance, right? And it's kind of like if I were to break my leg or to hurt myself really bad, I will pray for God to heal it, but I'm also going to go to someone at a hospital to get some assistance on that leg, right? I'm going to get myself put in a cast. I'm going to take an x-ray. I'm going to do the things that it takes to heal while still having my faith base. And the two are not mutually exclusive. And needing therapy does not mean that you don't have enough faith or that you don't love God. It means that you need somebody to talk to, right? It means that you need another set of professional eyes to take a look at what's happening for you and say, okay, these are the trends that I'm seeing. These are the behaviors I'm seeing. These are the symptoms I'm seeing. And that's really the purpose of therapy, is to give you another set of eyes that has a body of knowledge about mental health, about behavioral issues, about medication, about the things you may need, and help you kind of see that and fit that into your day-to-day life and give you the coping skills that you may need to move forward, okay? Do Black people get therapy? I hear that all the time. And the answer is absolutely, and we should, by the way, because there is so much trauma in day-to-day living that I really believe everybody needs a little bit of couch time, right? I really believe that we can get empowerment through counseling. It's not just my tagline for my company, but I really believe that therapy can give you the tools you need to take you from good to great, right? I think therapy can give you the tools you need to think about your life differently, to kind of change some of the thought processes that you have and give you the tools to make life better for yourself. And there's 1,000 tools. So people always say, okay, Dr. Noel, I came to therapy and I tried counting to 10. I tried deep breathing. Now what else do I have? And again, that's a great reason to come to therapy, is to figure out, what if we give you 50 tools? Which ones are going to work for you? And how can you use them consistently to get better, right? And so yes, people of any color, any shape, any size, not only come to therapy, but probably need to, right? I feel like so much of our lives is lived in silo. We watch things on Facebook, we watch Netflix, like everything we do is done in silo these days, like individual groups doing individual things. And we don't have enough coming together of people. Therapy gives you a space to have someone to say, listen, this is happening in my life. How do I manage it? How do I manage being a female in the world today? How do I manage being a male in the world today? How do I manage any of your life stuff? How do you manage that on a day-to-day basis, right? And therapy also helps to tell what's the difference between this is just the stuff that people go through, or this is pathology. There's something wrong. I've been sad longer than a week, longer than 2 weeks. Maybe it's been 6 months and you're feeling like you're entering into depression. And clinically, if sadness is gone for 6 months, then yes, that's probably where you're headed. And how can the therapist help you deal with that? You come into therapy and the therapist helps you to see kind of what your triggers are, that things will change, that there will be a better day tomorrow, that nothing stays the same. And sometimes when a person has depression or has OCD, which is really, these are real things. It's not something that you can wake up and say, oh, today I'm going to snap out of it. Many times these symptoms have gone on for so long that people don't see hope. And it's okay to come to therapy and get a little piece of hope, to get a little taste of hope, so that you can feel better than you do, right? And there's nothing to be ashamed of. Segueing into shame, people always ask me, what are all the shame and stigma associated with therapy? And the truth is that it's still here. There's still shame. There's still stigma associated with it. And it's because people don't truly understand mental health the way we do the physical body. We know that if you break a leg, that you can set that leg, that you can put it in a cast, that there's things that you can do to make it better. And no one really blames you for those things. But mental health or behavioral health issues or sadness or prolonged depression are the types of things that people say you can just snap out of it. You can just get out of it. And so there's some vulnerability and perceived weakness associated with coming in for therapy. But the truth is, you couldn't be stronger than a person that has the resilience to say, I've got to do something different so I can be better, feel better, live better, have a better life. Also, People are predisposed to certain things. Some people have a genetic component that adds to their depression. There's some genetics that adds to bipolar disorder, borderline personality, all of these huge diagnoses that we see all over the place these days. There's some genetic pieces to it. And if you're predisposed to something, just like anything else, if you're predisposed to diabetes, people say, hey, doctors say, listen, watch what you eat. Be careful, what your health intake is. And it's the same with behavioral health and mental health. If you're predisposed to something, sometimes coming into therapy to get treatment can remove some of the mystery surrounding it. You don't have to fall into constant episodes. We can help you put some things in place to stop the cycle of sadness or whatever the other things may be that people are experiencing. So yes, there's shame and stigma associated with it, mostly because largely folks are uneducated about mental health, and also because people really believe that mental health is something you can control, and you can control it, but you don't always get the chance to remove the mental health issue. But you can give yourself some things, some tools. A therapist can help you, and sometimes medication comes into play with things that you can do to make your life better, teaching you to add in those things on a regular basis that will help you be better, feel better, do better for long periods of time, right? But again, I don't want people out there blaming themselves for having mental health issues or saying, hey, I had a trauma a year ago. Why do I still feel this way? Why am I still sad? It's okay. Just come in and talk to somebody and remove some of the shame you have, and be in a place where you don't have to keep secrets, right? Because another thing with mental health is people generally keep things a secret, right? So if something goes wrong in a house, if there's trauma in a house and all the kids are affected by it, a lot of people teach, hey, what happens in our house, keep it in the house, as opposed to, listen, if something went wrong and you're not healthy, get the help that you need. And health professionals, therapists such as I am, feel like, come out, get the help you need in a space that will be safe for you, and know that we're not judging you, right? We're just trying to help you go from where you are to where you want to be. And another question that comes up is, how long will I need therapy? Well, some people have brief therapy, 6 to 8 sessions, right? And some people need it long term because some issues for people are deeper, harder to deal with, a little tougher to control. There's always a lot of outside forces. So no one just has one negative input coming in. They've got hundreds of inputs, both positive and negative, combined with our genetics and combined with things that are going on for us. How do we manage all of these things, and how long will it take? It could take a year, it could take 2 years. But again, nothing lasts forever. So you feel free to be able to know that you can come to your therapist for as long as it's serving its purpose for you, right? And you and your clinician should be working together to figure out what are the things that you need and how much longer do you need to stay, or do you need to stay long term, right? Like, I don't stop going to see my primary care physician. I check in once a year. I get exams once a year just to make sure I'm okay. And I want us to move towards getting mental health the same way, to feel empowered enough to know that, listen, let me go in once a year, twice a year, 3 times a year, 4 times a year, just to make sure that I'm okay, right? So I don't want people to think that, oh, after 3 sessions, I have to be okay. No, you may need longer. You may need shorter. It just depends on what those symptoms are and what clinician you have. So building rapport in the therapy room, something huge that I want patients to know about, or clients to know about. That rapport is super important, that you work with a clinician that you feel like can help you move from where you are to where you want to be. You don't have to love them. You're not going to marry them. You're not going to be with them forever. But clinicians always try to find a way to connect with you so we can help move you from where you are to where you want to be, along with all the hard work that you have to do. But make no mistake, the hard work is done on the part of the person that comes in. Everything that you're doing is the work that it's going to take you from where you are to where you want to be. And the consistency of that work is going to take you from where you are to where you want to be, and making sure that once you feel good, because that's another thing that people do in therapy. I feel really good, Dr. Noel. I came 4 times, the sun is out. So we stop doing it, right? Or you stop taking medication if you go see a psychiatrist. You stop doing the things that it would take to help you feel well. And one thing about therapy is it's got to be consistent. The things that you keep in your life to make you feel good have to be going on long term, so that you know that you have everything you need in place to make it okay. So if you have a car, you change the oil. You don't wait for it to break down. You don't wait for it to start smoking. For the most part, you look at it and go, okay, I've gone X amount of miles. I've got a diagram of what I should do. I'm gonna change the oil now. If your tires get low, you don't wait till you get a flat to change the tire. You say to yourself, wait a minute, I don't want my car to break down on me. I'm gonna fix the tire now. I'm gonna get new tires now. And therapy can be the same way. It can prevent some explosions and some pretty tough things if you're using therapy in the right way. What happens after therapy? How do I know I've developed tools? Well, a good clinician should be giving you homework, talking to you about what you need to be doing regularly, and helping you put some tools in the toolbox. Sometimes with my clients, we make a real box and we put real things into it and we pour real things out. Like, okay, when I'm stressed out, then Dr. Noel, what should I do? Okay, so let's go in this box. Let's pull out the things that you think you can use. Let's use a fidget spinner. Let's use maybe a note that someone gave you that lifts your spirits. Therapy is not a one-stop shop. It's not the one time in the gym that helps you do better. It's the repetitive and consistent use of the gym that helps you do better. And it's the same thing with therapy. It's not just the one time that you come to therapy that tomorrow you're going to be great. It's the repetitiveness, it's the consistency of talking about concerns and building some rapport and building some tools that are going to take you from where you are to where you want to be, and having some tools to use on hand. Like sometimes I have people make a list. What are the top 10 things that you can do to help yourself feel better throughout the day? If you have depression, what are some things that you can focus on throughout the day? What are some affirmations that you can do? What are some people that you can reach out to if you find yourself in a position where you don't want to go on anymore? What is that consistency that you have put in place for yourself with your clinician that you'll be using all the time? And those things develop into your coping skills.